So the most commonly asked question I get is, can I have a BBL with my tummy tuck? And the answer is a definitive yes. So the concern for doing a tummy tuck with a BBL stems from patients being concerned that they can't lay on their abdomen and stay completely off their buttocks. And that is a concern because we do want you to stay off your buttocks as much as possible. But you have to consider the fact that your alternative options may not be that great. So the alternative options would be to have liposuction and a tummy tuck procedure in two separate procedures. So now you're going to undergo two major procedures with significant expense to try to get the result that you want. And if you have the finances and you have enough fatty tissue to do that, that's great. But most people don't, and most people are going to get a very good result in one surgery. So the next question then becomes, well, if I'm gonna do a tummy tuck and maybe I want to do the liposuction and BBL in a second procedure also, which is first? 100% of the time, the answer is to do the tummy tuck first. So in the first surgery, you're gonna do a tummy tuck and you're gonna do some liposuction, and then you're gonna go ahead and do a BBL anyways. And then if you wanna have a second round, then you can go back and do additional liposuction of the back and put some additional fat in the buttocks. That way you're getting 2 rounds of BBL, and most patients are gonna be satisfied in 1 round, but then you'll be able to get a second round. So the problem becomes when there are doctors out there, and many of these are not even surgeons, many of them are not even plastic surgeons, who are telling you to do it in 2 surgeries and to do lipo and a BBL first. The main reason they're telling you to do that is because they're not trained to do tummy tucks. So they don't offer them, they don't do them, and they just want your business and they just want your money. So they ultimately may not care about your long-term result or the fibrosis you get or the terrible scarring in your tummy that becomes very difficult to fix with a tummy tuck, or mislead you into thinking you don't need a tummy tuck, or offer you gimmicky technology like Renuvian and J-Plasma that make you think that you can avoid a tummy tuck. So those are the problems that we see. So make sure that you're getting your tummy tuck first, and then you can go back and you can do the liposuction and further BBL if you desire it, but at least you don't have to have a second procedure then. Yes, you can have a tummy tuck, 360 lipo, and a BBL in one. And yes, you can do your best to stay off of it, and your result is gonna be excellent. But if you just want more, or you have some extra fat that was too much to get in one procedure, then you can have a second procedure and get an even better result. So keep those tips in mind, and you have a great outcome.